Three, two, one. Hey, everybody. Welcome again to the Waiver Wire Selection Podcast. I'm Dr. Mark Nunez, Doctor of Athletic Training, and my co-host is Landon Buford. Landon, how have you been?
I'm well. Yourself?
Can't complain. Just trying to wrap up the this playoff, the NBA playoff. Trying to see who's going to make it into the play-in tournament, who's going to make it into the playoffs, what teams are kind of struggling right now, and then more importantly, how are injuries going to be affecting some of these teams that are trying to get into that little playoff tournament type of thing.
Yeah, man. We're just trying to get back in a groove from last week. We missed last week, so we're just trying to keep on that streak. I'm Landon Buford. I'm a freelance journalist. I run my own website, landonbuford.com. I also can my past work can also be found on Forbes.com, SI, and 137, which is a VaynerMedia affiliate owned by Gary Vaynerchuk, or better known as Gary V for people that cannot pronounce his full name. But we're gonna go ahead and get started here.
And I think everybody knows him as Gary V. And like Landon mentioned, we apologize for missing last week because of a schedule conflict. We weren't able to get a podcast in for last week. But like I mentioned before, our goal here is to try to give you guys some inside information on some of these injuries. I know you tend to hear some lingo coming out of the teams. Sometimes they're very, very vague. Our job is to try to kind of give you what that actually means, or help you interpret what it means, especially for all you NBA basketball fans, fantasy owners or manager owners are trying to kind of see where you're going to plug in your teams. Because right now, I know you guys are in the playoffs for any basketball fantasy.
So we'll go ahead and start with the New York Knicks. Mr. Julius Randle went down with a leg sprain, I think. Let me see. Let me make sure. I think it was a leg sprain. And will be reevaluated tomorrow. That's all they gave us. Yeah. Your thoughts on that? I know it's not much, but just your thoughts on that?
Correct. So Julius Randle, this side over here, my guy who was with us with the Lakers. Unfortunately, it's sad for me to hear something like this. It doesn't sound like it's anything serious at the moment, but I remember when Julius was with us, he had that big issue with the tibia fracture type of thing. Now, having said that, as far as right now, like you mentioned, there's not much for us to go on. He had the leg injury. They probably did x-rays in the arena. Most arenas, if not all arenas, nowadays have x-ray machines in those arenas, so they'll automatically do an x-ray. And what most teams will do, they'll follow up with an MRI the next day to try to determine, see exactly what's going on, what ligaments have been sprained or damaged, if anything, any ligaments have been damaged, or any type of soft tissue has been damaged or injured. And at that point, the team will determine, kind of more of a timeline, see what's going on. And I know as far as Julius Randle, he's been having a great year this year again. I think he's been having maybe the last 2-3 years, he's been very successful. He's been having great seasons. He made the All-Star this year, and he's a great athlete in general.
They said that he hasn't missed any games this year. So yep. I mean, that's he's questionable for Friday. So obviously that's that might be in question, but we'll see. Obviously they said they'll have more tests tomorrow, so we'll see about that. Zion Williams is out of commission with a right hamstring strain, and it's uncertain if he will return to the lineup before the middle of April.
Correct.
Your thoughts on that?
And this is something that we talked about, and the reason why they're very, very kind of skeptical or being very conservative is because he re-aggravated the hamstring strain, and that's something that you and I have talked about. That hamstring strains, in general, can be very tricky. An athlete can feel great. Everything looks good. They go out there and kind of quickly re-aggravate it. I mean, if we look back at the NFL, we had Keenan Allen down here with the San Diego Chargers that had a hamstring strain. They suspected he was going to be out for about 2 weeks. He ended up being out, I believe, close to 8 to 9 weeks from that hamstring strain. Now, again, we've talked about this, a risk-reward. Right now, the New Orleans Pelicans, I know they're trying to get into the playoff, into the play-in tournament. I think last time I checked, they were technically out of it type of thing. So it's just a matter of seeing where they're at, whether they're going to go ahead and bring Zion early to try to kind of make that push into the playoff tournament. But if they do that, they may, not jeopardize, but put him a little bit higher risk. But like I said, because it's the second time around, they're going to be very super conservative. He is their franchise player, so they're not going to mess with that type of thing. We've seen in the past they've been very conservative with his ankle issues. So it's just a matter of seeing where they're sitting. Again, it comes out to the risk reward.
Paul George is out of action with a right knee sprain and is expected to miss 2 to 3 weeks with this knee sprain.
So, and that's the interesting part about it is that he's expected to be out a minimum of 2 to 3 weeks. Now, this is very similar to remember Kawhi Leonard had an ACL sprain a couple of years ago. Same thing. They were trying to kind of make it to the playoffs, and we're going to see how they do. Now, does it mean that he's going to return in 2 to 3 weeks? No, it does not mean that he's going to return in 2 to 3 weeks. What they suspect is that he's going to be out for 2 to 3 weeks, see how he does, reevaluate it, do another MRI to make sure that the ACL is still intact or it's been healing, and then he can go and return. So just a 2 to 3 week timeline, unfortunately, doesn't mean that he's going to be back in 2 to 3 weeks. So for all you that do have Paul George on your lineup as fantasy, it's going to be tough to see if he does actually return in 2 to 3 weeks. My goal is that I'd like for him to see him return to practice first with no restrictions. Then that's going to determine whether he is going to be able to return to the game or not.
We kind of talked about Cade Cunningham. He has shin problems, right? It says he will miss the rest of the season. Obviously, we talked about that before. After having surgery to repair a left tibial stress fracture. Typically, how long does that take to recover? What is the recovery period? He's out for the season, but when can he begin? Rehab, I guess, and get prepared for next season.
So any type of stress fracture or fractures usually takes anywhere between 4 to 6 weeks minimum. That's about the average time for somebody to be able to return to kind of full activity or close to returning to do some kind of activity. So him being out for at least 6 weeks, they did it already. So they already speculate he's going to be out for the rest of the season because we only have 2 weeks, 3 weeks left max in the season type of thing. So he's out for the rest of the year type of thing. So you could probably expect him to return to activity probably by the end of April. But again, it's going to the off season. They're not going to rush him back. The goals have him ready for the upcoming season type of thing. So they're going to be a little more conservative. Same thing, kind of stretch out that 4 to 6 weeks, probably more to 6 to 8 weeks, and then have him ready for next year because that's the ultimate goal.
So we know Ben Simmons got a back issue, right? He's obviously out for the remainder of the season. He had a nerve impingement in his back. Did I pronounce that right?
Yep, impingement.
I'm sorry. What do you think needs to be done, or what from your expertise, what needs to be done for him to actually come back and be fully, serviceable? As it where it's just a mental situation where he can physically be back on the court. Mental is something totally different.
Correct. So this is a little iffy and a little tough situation for Ben Simmons and also for the Philadelphia 76ers, so to speak.
Brooklyn Nets.
I'm sorry, Brooklyn Nets. Brooklyn Nets. I apologize. Brooklyn Nets. For the Brooklyn Nets. One, the fact that he has the nerve impingement, what that indicates is that your spinal cord, all the nerves kind of go down your spinal cord. And the impingement means that the nerve is getting pinched somewhere. And when the nerve gets pinched, it doesn't send message to the rest of the body or where the nerve innervates, most likely to kind of to the lower leg, the hamstring, the quad, or anything of that sort. It's almost imagine when you fall asleep on your arm and then you kind of wake up and your arm's got that tingle. Exactly. It's kind of numb. Well, in this case, because the impingement is going on, he has that constant kind of slight numbness or tingling kind of radiating down his leg. So the issue is what's causing that impingement? Does it have to be surgically repaired to try to kind of take that pressure off that impingement? Can it be done through rehab, meaning he's got to strengthen what we call your core stabilizer muscles, get in the right program to try to kind of prevent that from happening. Now, the only other issue is that he's had this for several years already. I mean, he's missed games, he's missed half of the season, has missed months because of the same issue type of thing. So it's gotten to the point where either he himself, his agent, or the team has to decide, hey, is he to the point that he may need surgery to try to kind of fix this and get him ready for next year? Or do we just go ahead and kind of rehab him and then keep our fingers crossed and then he's able to kind of proceed and play for the rest of the year? Unfortunately, I don't know the details of the impingement. I don't know the details of where it's at type of thing. So I can't really say, hey, he's gotten to the point that needs surgery. But so far, they've been somewhat able to manage it, so to speak, but not to the point that they've been able to manage to the point where he's able to successfully play a full season.
And Jokic is questionable with a calf injury for tomorrow's game against the Pelicans.
Correct. So
it's right calfness tightness.
Okay, so I'll take that over strain. The tightness probably indicates that he's probably either it was cramping that area. He's probably having difficulty kind of plantar flexing or dorsiflexing that calf that foot area type of thing. Which I'd rather take that than an actual kind of calf strain right now. So the team's probably being precautionary, and because he has a tightness and having some kind of muscular tightness can potentially lead to an increased risk of actually tearing the muscle and resulting in a strain. So the team is probably being smart right now. They're sitting pretty at the first spot anyway, so there's no need for him to be in there. I think Memphis has I think they have maybe a 2-game lead on them. I don't see Denver falling out of the first spot, going to the playoff type of thing. They've already clinched the playoffs, playoff berth type of thing. So they're just trying to kind of keep that number one spot. He is their franchise player. He is their key role player. He is the MVP for the last I think he got MVP last year.
He's the last. He's a 2-time MVP.
2-time, and there's talks about that he may be 3 times. Type of thing. So they're just playing it safe. Again, the risk reward, the risk for him to participate in the game and aggravate that and actually tear it is higher than the reward they're going to get from winning a game type of thing. So right now they just want to kind of let him rest, make sure he feels comfortable, and pretty much get him ready into the playoffs. Because most of these teams right now are more thinking of the playoff. They're not thinking of the rest of the season. They just want to finish the season, get it over with, limit the amount of injuries they're gonna gain if they do gain any, and then go healthy into the offseason.
Okay, so he's been ruling out for a while. I think it's a ACL issue, but he's been out since September. So I'm trying to figure out roughly when he would come back next season. We're talking about Danilo Gallinari. He was out as of September 8th of last year. So basically right before the season started. He's expected to, he obviously is missing the entire season. So when can we expect him back from this ACL injury, roughly?
Correct. So and this is also a little bit different and kind of interesting because Gallinari has had another ACL injury in the past. So this is not his first ACL injury. This is the second ACL injury. I don't know whether it's in the same leg. And this kind of goes very similar to Odell Beckham Jr. when the NFL. Odell Beckham Jr. had it in the Super Bowl. He missed his whole entire season. Just recently, I think I was reading reports about him starting to kind of participate in tryouts and workouts to try to teams. And most teams, I think the reports out there saying that he looks pretty good. So as far as Gallinari, I expect him to be out. I mean, the season is pretty much over. He's already done. For an athlete like him, he's also older, has aged, has a previous injury of ACL injury. I expect him to be out a full year from the date of injury. So I expect him he can definitely potentially return to a training camp next year, but I don't expect him to be active till maybe about as early as, I would say, July or August.
Okay.
Yeah.
Okay. I know Adams, they've shut him down for the regular season. He had stem cells injections into his right knee. So that's what he was dealing with him. Braun said he had a tendon issue. That's what kept him out. He's back now, but was that anything different than what we were expecting? Because obviously they said it was in his foot. So tendon wise, how does that work compared to, because at first people thought he was probably going to be out for the rest of the regular season. Now he's obviously back, and I don't want to speak on him, you know what I'm saying, because he speaks for himself, right, according to the tweet, right? So
right.
Yeah.
So as far as him being back, it's great to see him kind of back. Do I see him at 100% right now? He's definitely not 100%, and he may have a little bit of issues kind of going into the finishing off the regular season. Now, the difficult part here is you can strain a tendon, you can strain a muscle, or you can sprain a ligament. Out of all these three, I'd rather have a sprained ligament or I'd rather have a strained muscle, not the tendon. And the reason being is that the tendon itself has very poor blood supply. And that's something that we've talked about. So it's very difficult to kind of for the tendon to heal on its own, or at least takes longer for the tendon to heal compared to the muscle being strained or even a ligament being sprained type of thing. Also, there's much more tension into the tendon when he's moving around, especially in the foot. So I'm sure he's probably still having some issues. I'm sure he's still having some discomfort. I'm sure they're just kind of treating him. I'd be very surprised right now if he's actually participating in practice. At this point, who he is, finish up the season, the injury that he has, most likely he's just participating in games. He's staying off his foot during the practices, resting it, getting treatment, and hopefully kind of getting LeBron into the roster so they can hopefully make the play-in tournament and then kind of go into the playoffs. This is kind of very similar to what happened, I think 2 years ago when he had the high ankle sprain, and this is something that we talked about already.
Mm-hmm. I just wanted to make sure exactly that's what it was, but I think that's what it was.
Yeah, and I think all the reports have been the same, that it's been a tendon. It's not been a muscle, and it's not been a ligament. It's everything. The whole thing's been everything that's been reported. Everything that I've read and I've seen has been a tendon. The tendon in the foot.
Okay.
The only question is that they haven't really reported which tendon or which muscle is the one that's been affected. That's the only thing I haven't read or heard.
And I think they're doing that so individuals like yourself can't basically say exactly which one it is, right? It's and some might say, depending on what it is, some might say you don't think it's a good idea that he's playing, or except or such, or depending on what it is, right?
Correct, and that's the thing. If every muscle, it's like, think of it as a puppet. Every muscle affects the foot in different pattern, and every muscle makes the foot move at a different angle. If we were to know which muscle, which tendon is the one that's been aggravated, I would have a better idea. Hey, you know what? It's more of the arch support, more on the outside, it's more of the push-ups, more on the landing, dorsiflexion, plantar flexor, anything of that sort. But they haven't reported as far as what muscle it is or which tendon.
And when they talked to him when they came back, I think it was maybe a couple games ago. I forget exactly which one it was, but they said that he told them that obviously he didn't need surgery right now. He might have it at the after the season, or whenever it ends, things of that nature. But he said right now he doesn't need surgery for it. But yeah, I mean that just means he can't be hurt. He can't be I guess injured anymore. Is that technically what that means, or how does that?
Correct. So yeah, and I think I read the same reports. I think what I read is there's 2 doctors that recommended him having season-ending surgery and then pretty much be done for the year. And then he spoke to another expert, another physician that recommended, hey, you know what, you don't need surgery right now. You can kind of play through it and kind of finish off the season type of thing. So even though that's happened, the fact that the injury's still there, and that's what I was saying, is that I don't think he's out of the woods, so to speak. I don't think he's 100%. I don't think he's like, hey, I'm ready to go. I'm fine. I can play like I used to type of thing. The injury's still there. There's a risk that he may completely rupture the tendon, and then he's going to need surgery type of thing. So there's still a little bit of a risk on that part. The question, again, is the risk reward. I think the Lakers feel that they have a pretty good squad right now if LeBron's on there to be able to make a good run for the playoffs. So I think he's trying to kind of make that push. Again, if they weren't even anywhere near the play-in tournament, I would probably suspect that he would probably call it quits, have the surgery, and be done.
Right. And he also said that basically since he doesn't talk to media people in the offseason, he doesn't have to worry about giving updates. He said he'll be fine by the time the season rolls around.
I read that report saying that that the media, you guys wouldn't even know whether I had surgery or not because I don't have to talk to you guys. By the time the season comes around, I should be ready to roll.
Yep. I guess Kuzma's out with a ankle injury, sprain, and there's no timetable for his return. Well, they're spiraling down in the wrong direction, so I'm assuming that they're gonna close. They're about to close up shop on Kuzma, basically, in the season with that, pretty much.
Correct.
That means.
Exactly, 100%. They haven't reported whether it's a first degree, second degree sprain. Like I mentioned, they're spiraling out of control. They're pretty much going to probably be out whatsoever, so there's no need to rush him back. They've shut him down for the rest of the year, so that kind of indicates that the Wizards are pretty much saying, you know what, that's a wrap.
So I know he's not on the injury report, but I know that toe is bothering him because obviously he's not getting much lift off of his foot. I mean, as much as he normally would. I'm talking about Mr. Wizard, Kyrie Irving. That's who I'm talking about. Just thoughts about that. And what I guess he's is willing to go through the pain, I guess. But like, how? I mean, will you think he would need surgery on his toe or his foot in the offseason? I'll just
So
ask that.
I guess the question one, I don't know the exact details as far as what's going on with the toe, but yes, you're right. He's been complaining about the toe. There's been issues with the toe type of thing. Question number one is, does he need surgery to treat whatever he has? Is it more of a chronic issue, which that's kind of what I suspect. And if it is a chronic issue, he may get more of a non-surgical treatment, more like either a PRP with stem cell or something like that, or kind of treat it conservatively in that manner. It doesn't sound like he's going to require surgery. At least that's what I've read right now in all the reports. He's able to play in it and kind of move around. Yes, he has some discomfort. He doesn't have that, like you mentioned, that push up. And that's the thing about the toe, just like with baseball pitchers, and it's something that I've talked about. When a baseball pitcher gets a blister on their thumb, that's it. They're done. I mean, it's something blister because that's how they throw the curveballs, throw anything of the sort. Same thing with basketball players. If you look at the mechanics of the foot, when they jump off the ground, the last thing that leaves the ground is their big toe, and the first thing that hits the ground is their big toe. And your big toe is required as far as movement, allows you to keep balance. Otherwise, if not, then you start inverting your foot more towards the outside. And you start running at a little bit of an angle, and you can't do that as an athlete because now you're going to be compensating, and you can create other injuries type of thing. Two, that loses your mechanics, that loses your movements. You're not, like you mentioned, you're not explosive. You're not yourself when you have that discomfort in your big toe. You need your big toe to be able to pivot, move, and jump around.
Obviously, PRP's been thrown around a lot, and then most recently, there's been a lot of individuals that think that it's not, I guess, legal, that type of thing. They're throwing other things around. I guess I don't want to get into that portion, but can you explain exactly what the procedure is, and ease people's mind in regards to the procedure, and I guess people thinking it's giving an athlete an unfair advantage. I'll put it that way.
Almost like a performance enhancement.
Yeah. Mm-hmm.
Yeah. No. So PRP stands for platelet-rich plasma. So basically, what you do is when you go to the doctor, they take some blood out of you, and what they do, they spin it, and they take all the plasma, the good blood cells in there that create the healing process. So what happens naturally? Let's say you sprain your ankle, and what happens is the body naturally, to try to fix it, is going to rush blood to that area to heal that ligament. Just like when you get a cut anywhere in your forearm here, blood starts gushing to that area, and the reason why blood gushes to that area is to try to kind of close it up. It's doing its job. It kind of closes up. People that are referred to as anemia and have anemia or are anemic, they don't have that blood coagulation to kind of build it up. So to kind of think of it as almost think of it as when the beaver kind of creates a dam and they kind of block off the water, so it's kind of building on top of each other. Your body naturally does that. It's your body's job. Okay. Now, what happens is that the platelet-rich plasma is that you're sending white blood cells, better blood, so to speak, or you spin the blood that you only get the good part, and then you inject it right into the area. So you're speeding up the healing process. So you're sending blood to that area to try kind of expedite or increase the healing process. Now, some areas where have poor blood supply, like the tendonitis, any tendon has more blood supply. By injecting blood in the area, you're creating what's called the inflammatory response. You're creating the healing process. You're almost forcing that healing process to kind of do its job. You're almost kind of nudging it, type of thing. So it's not a performance enhancement procedure whatsoever. It's almost like you're assisting your body to heal itself quicker, or at least redirecting it. Hey, this is where we want the blood to go, so we're going to take it from here and inject it in there for it to be able to kind of create itself. So that's all it is. It's just sending good blood, so to speak, for it to heal.
Okay. All right, let me see if there's anybody else on here. I know it's during games, so it's kind of hard to do that while games are on tonight. Kevin Durant's playing, so there's really no point. He's probably, before I turned on the recording, I know he was on the bench. Probably, he's probably got a minute restriction, probably. But
correct. But it's actually good to see that he's actually out there, even if he has a minute restriction type of thing. So what I anticipate what they're doing is trying to kind of ease him back. give him some minutes right now. So when the playoffs begin, he's not kind of like starting from fresh because he still has to mesh with this team. He really hasn't had much time. I think he had 3 games or 4 games before he sprained his ankle.
Yep.
And I mean, he was doing well. He was meshing. They went through. I think they went 3-0 or 4-0 while he was participating. So I think right now they want to kind of ease him into it. There's no need to rush him back right now. I think the Phoenix Suns are okay in the playoffs. I think last time I checked, were they still in the 4th spot?
They're in the 4th spot right now.
4th spot. So as long as they stay within the top 4, they're going to have home court advantage for a majority of the playoffs, with the exception of, or it depends what happens for the finals or the Western Conference finals.
Yeah.
So I think right now they're trying to ease him into it. You're right. Most likely he has been in restrictions and see how he progresses. But the goal is, again, a team like the Phoenix Suns right now, they're looking forward into the playoffs. They're not worried about the season, but they want to get KD ready for the playoffs.
Correct. Okay. I see what you're saying. And Devin Booker was saying that yesterday in a post-practice interview, he was talking about, obviously during the rehab process, the thing that hurts the most, you're not able to hoop, and also like you're not able to get out there and run, physical plays. Like everything that you're doing is pretty much it's mind control kind of. You're like getting your mind in a certain place because of you're not able to physically go out and have. You're dealing with the coaching staff, but they're not pushing you game speed and things of that nature. They're trying to you're in a rehab stage, so you could do the lightest of rehab stuff, but it won't mimic game full game minutes because they're not trying to hurt. I don't want to say that the other team's trying to hurt you, but they're not going to test that injury. They're not going to test what's it called. They're trying to make sure that you're healthy enough to get back on the court. They're not trying to push your endurance in regards to an actual full game experience. So
no, you're 100% correct. There's no such thing as replicating game situation until you actually get into an actual game. Even though you scrimmage with your team, it's still not the same thing because your teammates they know that you have an ankle sprain. They're not going to go 100%. Their goal out there is not to push you and, like you mentioned, not necessarily hurt you, but actually push you to the limit, so to speak, because they're gonna hold back because they don't want to be.
They don't want you to be re-hindered. Yeah,
exactly. So a scrimmage with your own teammates, it's nowhere near the same as actually competing in a game with an opponent, and not until you get out there. So this is what I think what the Phoenix Suns are utilizing these last maybe 7 games of the season to allow KD to get back into that rhythm of game situation without having any setbacks or re-aggravating his ankle, so he can be ready for the playoffs.
Okay, that makes sense. All right, we're gonna go ahead and cut it short for tonight. If you guys need any more answers for injuries that happen after this is published, you could let either one of us know. And obviously, if it's me, I'll get in contact with Marco and try to get those answers. If you need it directly from him, I mean, obviously you can get it on his social medias. Where can they find you, Marco?
Yeah, if you guys have any questions regarding any injuries among the NBA players or just players in general, or injuries that you might personally have, feel free to DM me on my Instagram at Marco Nunez ATC.
And then mine is just Landon Buford at everything on IG, Instagram, and yeah, pretty much that is it for us. Mm-hmm. Thank you guys for another Marco for another episode. Obviously, like you said earlier, we're going to try to keep these more episodes more consistent. It's not just basketball that we're going to be trying to that we're going to be involved in. We're going to try to venture off into the other sports as well, so we can help all you guys' leagues or just fantasy your fantasy leagues in general, or if you just you're interested in your team's I guess at full strength that particular day. So
baseball starting up this Friday, or actually no, Saturday, April 1st.
Saturday. Mm-hmm.
Major League Baseball is kicking off.
So thank you guys. We'll catch y'all next week.
Thank you, everybody.